I am Dr. Ambuja Bhardwaj and I am going to present the topic Physiotherapy Management of Low Back Pain. So in this presentation we will learn about introduction of low back pain, what causes low back pain, what are the symptoms of low back pain, physiotherapy exercises for low back pain and home advice. So introduction, low back pain or low back is also called lumbar region. It is the area of the back that starts below the rib cage. As you can see in the given diagram, the area colored with red is the lumbar region and it is representing the low back. The pain in this region is known as low back pain. Low back pain affects nearly 60 to 80% of people throughout their lifetime. According to the researchers, 11 to 12% of the population gets disabled by low back pain. That is, out of 60 to 80%, 11 to 12% of the people used to get disabled. That is, they become dependent upon other people for their daily activities. They become unable to do their activities of daily living. Low back pain is usually categorized in three subtypes depending upon the time duration. The divisions are like acute, subacute and chronic divisions. In acute, we include the low back pain, which includes the low back pain episodes for less than 6 weeks. That is, if someone is having low back pain and the pain is there for less than 6 weeks, then it is considered as acute pain. And the second is subacute low back pain. So if low back pain is persisting between the time duration of 6 to 12 weeks, then it is characterized as subacute low back pain. And the most severe one is the chronic pain, that is low back pain which is there for more than 12 weeks. We can also do the division on the basis of the reason. For example, if someone had some traumatic injury like fall from a great height or hit from some object or some equipment, that can be considered as a chronic condition. That is, which is more severe, that is, which will take more time to get healed. Whereas if person is having low back pain because he was driving for a consistent or substantial amount of time, or someone is having low back pain just because he has lifted some heavy object, that will be included in the acute condition. That is a condition which will take lesser time for healing and which will be healed faster and in an easier way. Common causes of low back pain. So there are some reasons which can lead to low back pain in you. The reasons can be manual material handling. For example, if you are lifting a heavy object, as you can see in the picture here, the person is lifting the heavy object, but if you are not using the specific procedure for lifting, that is, you are lifting with your spine in the bent position, then you will put extra load over your lumbar spine. Instead of doing like that, if you bend your knees and then you lift the heavy object, then it will not result in any pressure over your lumbar back. In this condition, you will be using maximum force from your knees and from your chest area, because when you will be lifting, you will attach that thing with your chest part and with your knee part, and it will be easier for you to lift that without using your limb muscles, without using your lumbar muscles to their extent. Specifically, if person is not doing strengthening activities of lumbar spine, then the things like lifting something heavier or pulling something heavier can result in sudden traumatized back pain. Then twisting of the trunk. Excessive reaching. Excessive reaching means that when we try to extend the lumbar area, when we try to overstretch the muscles to pick some things up or to pick some things from higher heights, then it can result in the back pain. Then fall from a height, or if a person suddenly falls, and then there are the chances that the trunk muscles can get twisted, they can get traumatized, they can get injured because of a fall, or prolonged sitting. We can see in number of occupations, in number of conditions, people used to sit for a longer time. For example, in professions like computer operators, they have to sit for a very long time. In fact, if we are having a job where we have to maintain a specific posture for longer time, like standing posture, as we can see in professors, in teachers, they have to stand for a prolonged amount of time, or in the case when the people used to travel in the bus where there is no seats and they have to stand, then also there can be pain in the back. Why? Because the back muscles are the muscles which work for longer period of time. They will be working for 24 hours. For the time for which you are standing or you are sitting, your neck will be upheld high, your back will be straight, or your hip muscles will be straight. So it means that the back muscles are the one which are working for 24 hours. Okay, whereas the other muscles, they used to go for rest, like biceps muscle, triceps muscle, the muscles of arm, they used to go for rest. But the back muscles, they work for prolonged period of time. That's why they used to get exerted, they used to get exhausted. And the people who are who are doing the sedentary jobs, they don't give a substantial amount of time for their exercises. Their muscles are not strengthened up. So when the muscles are not having that amount of strength and still people are putting extra weight on their muscles, that can lead to the weakness. Then highly physical jobs, again the jobs like laborers, miners, who have to put extra physical strength in their job. But as I have told you, the strength of the muscle depends upon the diet that you take. That is, if you are having good amount of protein in your diet, the proteins are required for the muscle strengthening, for healing the injured muscles, because proteins are basically the amino acids which will provide the strength to the muscle. The muscle will get healed easier if person is taking more protein, and if person is doing proper strengthening, then the muscles will become more strong. But if a person is not taking a proper diet and not doing the proper exercises, then still if he is doing highly physical jobs, it can result in back pain. Then obesity. Obesity is a very common cause of back pain, because when a person is obese, he is basically taking extra weight as compared to the other people who are present around the person. If you are obese, if you are overweight, you are taking the extra weight on your abdominal area. We'll see the concavity of lumbar spine of a person who is obese is more than a person who is not obese or who is healthier. Okay, so obesity always results in extra weight over the lumbar area. They used to get under extra pressure throughout the day. Whenever you are standing, you are sitting, your back is in extra pressure. So that can result in low back pain. As in the diagrams, you can see trauma, that someone had fall on the back area. Then degenerative conditions. Degenerative conditions are the conditions which used to come at a specific age, at a specific point of life. For example, after the age of 40, and nowadays it is 40 or 45 because of the decrement in the type of food or type of nutrition that we are having. So arthritis can result in weakness in the bones, weakness in the muscle tissue, weakness in the disc which is present between the two vertebrae, because the water content in the disc is very much important for maintaining the flexibility of the disc. So when the person is not having that amount of nutrition in the body, the disc size used to get decreased. That will result in decrease in joint space. So when the joint space will decrease, that person will be more prone to injure his back, his or her back, when he will be doing some excessive activity. Comparing to that, a person who is younger, that person's disc height will be normal. Okay, that person will be having normal nutrition. So when that person will do some highly exhausting activity, we will not see the similar changes. But senile age, at the senile age, people should be more cautious about the weight they are lifting or the work they are doing. Okay, so these are the common causes of low back pain. Symptoms of low back pain. How we will know that whether the pain is low back pain, or it doesn't simply mean that the pain in the lumbar area is considered as low back pain. Sometimes in low back pain, actually the palpable pain, that is the pain that you can feel or touch, is not there on low back, but it is radiating through the leg. Sometimes we will see that people used to have a radiating pain, that is a traveling pain in the leg or in the arm area. That can also be because of some sort of back pain or back muscle issue, back muscle tightness or back muscle stiffness. Okay, so the main root cause will be lower back pain, but people will say that I am having pain in my leg or I am having pain in my arm, but the root cause will be the lumbar vertebrae. So low back pain symptoms. So does your back hurt? Low back pain symptoms range from sharp and stabbing to dull ache. So it can be very sharp pain that will not allow you to even stand or sit or change the position. Even if you will breathe very heavily, you will have pain in the back. That pain is called as sharp pain or stabbing pain. Or it can be a dull ache. Dull ache means a pain which will be there while you do some activities, and it will be relieved when you will take rest. For example, the person will be having the pain while the person will walk, or while the person will climb stairs, or when the person will lift some nominal weight like lifting a purse, etc. But when the person will be lying or when the person will be relaxing, the person will not have any sort of pain, or the pain will progress day by day. That is, on the day 1 the person will not be having severe pain, but as the time duration will exceed, the person's pain will also exceed. Okay, so that is the pain that will be ranging from sharp pain and dull ache. Sharp pain is normally from the traumatic conditions, again like sudden fall, sudden jerk. For example, if you are traveling on a bike and suddenly a speed breaker is there, but you haven't reduced the speed of your bike and suddenly you had a jerk, so that can result in sudden tear of the lumbar muscles. That can result in sudden breakage or sudden trauma to the bone, to the lumbar bone, to the vertebrae. So that will result in sharp pain. So whenever you will do some activity which needs sudden like sitting, or going from standing to sitting, or going from sitting to standing, shifting the position, that can result in sharp back pain. And dull ache will normally be because of some sort of pathology. For example, a person who is suffering from anemia, that person's all muscles will be weak. So when the person will stand, the muscles will not support. So that will result in dull ache. The pain can be constant. That is, the person is having the pain right from the time when the person has woke up to the point when the person is going to sleep. Up till that point, the person will have pain. So the pain can be constant. Pain can be intermittent. That is, the person is having pain when he is working, and when the person goes for rest, now the person is not having the pain. So the pain can be intermittent. Or it can be positional. That is, the person is having pain in some position, but when the person changes the position, then the pain also goes. Then stinging, burning pain that moves from low back to the back of the thigh, sometimes to the lower leg or feet, can include numbness or tingling, which is a very common name, that is sciatica. We see normally people nowadays after the age of 48 or after the age of 50, we see sciatica is very common. Sciatica is a pain which normally it appears in the leg. It radiates from the lower back to the leg. It appears when the space between the vertebra decreases, and then it impinges the sciatic nerve. Okay, so we see that all the nerves are arising from the vertebrae. So when the space between the vertebrae decrease, the nerves used to get trapped between the vertebrae, and whenever the person will be doing some lifting, some walking, or whenever the muscles will get exhausted, the sciatic nerve will be impinged and it will result in severe pain in the leg. Okay, so here the pain is in the leg, but the root cause is low back pain. Then muscle spasm, tightness in the lower back. Normally the tightness and muscle spasm are more common in the people who are having sitting jobs. For example, again, the computer operators or the teachers or the doctors who have to sit in the OPD for longer period of time. So when you have to do a sitting job where your movement is limited or it is restricted, that is, you have to sit for 3 or to 4 hours straight, obviously the back muscles will get stiff. They will be shortened in that position only. So there will be muscle spasm, there will be muscle tightness, and it will be in lower back, in the hip area and in the pelvic area. Pain that worsens after prolonged sitting or standing. So there can be a pain when you are standing or when you are walking, then the person will not feel pain. But if person continues to sit, for example, if he is sitting for half an hour, he is not having pain. But if that time exceeds, for example, he is sitting for 1 hour straight or 2 hours straight, then the person is experiencing pain. So that is one of the symptoms of low back pain. It means that your muscles are very weak and you should start with your physiotherapy management. Otherwise, what will happen? This time period, it will get shortened. For example, if earlier you were able to sit for 2 hours straight, afterwards if you will ignore this, then you will not be able to sit for even half an hour. Then difficulty standing up straight. That is, a person can stand with the stoop posture but will not be able to stand straight with the back straight. or while walking, or going from standing to sitting. So as I was saying, and that too if you are sitting on some low chair, okay, or the chair whose position is very low, if you are sitting there, or you are sitting on a bed or mattress which are not at your buttock level, then the person will have pain. Okay, so if you are experiencing all of these symptoms, it means that you will be having severe low back pain in future, or you are having low back pain now. Then prevention of low back pain. We all know that it's always better, that prevention is always better than cure. If we can prevent low back pain, it is best. It is the best thing which we can do to us. First is strengthen your trunk muscles daily. See, we all have to do some sort of jobs in our daily routine for the occupation, for daily breadwinning. We have to do some job, and the job will obviously demand from your body the physical strength, the mental strength. Obviously the job will demand that. If you are a teacher, you have to stand and give a lecture for 1 hour straight. If you are a computer operator, you have to sit. If you are a doctor, you have to sit and treat patients for 3 hours, 4 hours straight. If you are a surgeon, you have to stand and treat the patient. You cannot give excuses for that. I will not be able to do this because I'm having low back pain. So all the occupations, in some manner, they demand the physical strength or the mental contributions from that person. So instead of avoiding to do those activities, it is important that we strengthen our back muscles so that we can do the activity and still we can be healthy. Okay, so best way is strengthening the back muscles or trunk muscles. Strong and supportive muscles throughout the trunk of your body are essential to support your spine. If your muscles are strong, then at whatever age you are, even if the person reaches to the age of 60 or 70, but he has been continuously doing the exercises, obviously when the person will reach to that point, to 60 years of age or 70 years of age, the person will not be having that amount of pain. The muscles will be strong enough to do the daily course. The person will not be depending upon others for his work, his activity. Okay, it includes low impact cardiovascular exercises. Cardiovascular we are using because these exercises are the one which will affect the heart muscles also, and the blood arteries and blood veins also. So normal activities like brisk walk, normal walk, it will increase the blood flow to the spine. So when you are sitting on a specific position for a specific period of time, the blood circulation to that part it reduces, and it normally results in spasm and pain. Because if you are sitting straight and you are not doing any other work, any other activity, then the blood supply to that part it decreases because it is basically at a stable position. But when you do walking, brisk walking or jogging, that will increase the blood circulation. Increased blood circulation will increase the nutrient supply to that area. That area will heal faster. That area will be healthier. When you do exercise, your blood circulation increases, and that increased circulation increases the strength and increases the nutritional supply, oxygen supply to that part. Okay, so it automatically gets healthy. An adequate flow of blood supply, healing nutrients and hydration to the structure in your lower back, as I have informed. Other exercises that can be used for preventing low back pain are exercise ball workouts, such as sitting on the ball intermittently for about 20 to 30 minutes, because when you are sitting on the ball, you have to hold that position. Your muscles will be contracted so that you can maintain that position. That will increase the blood circulation to the lumbar muscles, and that will increase the nutritional supply to the lumbar muscles. Then investing in an ergonomic office chair. So if we are having ergonomically correct, that is a chair which will promote a good posture, then if you are using that chair, that will help you in maintaining a better posture at work. Even if you are sitting on that chair, you will not be having pain. Even if you use it for 3 hours straight or 4 hours straight, the ergonomically correct chair will maintain your posture, and it will see up to the fact that your muscles doesn't get strained or stiffed after you complete your work. Then other preventive techniques include safeguarding your back while lifting. So when we lift some heavy object, common activities, the day-to-day activities, they include activities like unloading grocery bags from the car, lifting your young child. It can lead to lower back problems. Okay, so when we are lifting something but our muscles are not strengthened enough, our muscles are not having that sort of power to lift the heavy object, but we are still putting extra load over the muscles, that can result in lower back pain. We are having few lifting guidelines to prevent the low back injury. As you can see in the diagram, here the person is bending at knees and not lowering the back, because when you lift something and you are bending your back, that will result in overstretching of your lumbar muscles. Okay, if a person is doing that, then the back is highly susceptible to ligament injury or disc injury. Then pivot your feet and hips rather than twisting your lower back. So when you are lifting something and you have to twist, or if you have to rotate, then you should always pivot your feet. You have to turn your feet and your hips rather than twisting your back. Then hold the object close to your chest while straightening your spine. So the thing which you are lifting, it should not be in the air. You should hold it with your chest and then you should lift it, so that it doesn't result in any sort of traumatize or tears or lesions in your lumbar muscles. Now in physiotherapy, we are having different electrotherapy modalities. Modalities means the machines that uses electrical supply for giving pain relief therapies, or for giving relieving muscle spasm relieving therapies, or giving muscle tightness relieving therapies. We can use heat and cold therapy. The application of heat or application of ice, it is easily available and they are easy to give. A person can give hot therapy or cold therapy at home also in the case of muscle tears or lesions, and they are most commonly used type of modality. So whenever a pain is there, suppose a person has drive a car for continuously for a day and the person is having back pain because of it, an application of hot pack can result in muscle warming and muscle lengthening also. Then we are having transcutaneous electrical nerve stimulator. It is clear from the name only that it is a nerve stimulator. The nerves which are taking the messages of pain to the brain, those nerves will be stimulated and the person will not feel the pain on the lower back. So these are the modalities that we use to decrease the pain of lower back in a person. Then ultrasound. Ultrasound is a form of deep heating in which we use sound waves which are applied to the skin, which penetrate the soft tissue. The application of ultrasound increases the flow of blood to the part on which ultrasound is applied. It will increase the nutritional supply to the part on which you are applying the ultrasound, and it will result in better healing. Now coming to the physiotherapy exercises, every low back condition is different, every patient is different. We cannot prescribe same exercises to all the patients. It will always depend upon the condition, upon the age of the patient, upon the cause of injury or cause of pain, that why the person was having low back pain at the first place. On that basis we define or we prescribe exercises. But there are some exercises which can be done on the daily basis for strengthening of the lumbar muscles. First you can see is the cat and cow pose. In this, person has to lie on the floor and keep the back straight. Then the person has to bend the spine outward and upward towards the ceiling. While holding this pose, the person will be able to stretch the neck muscles and the back muscles. And when the person will do backward or back inward and downward activity, then person will be able to stretch the lower back. So by maintaining cat and cow pose, you will be able to stretch your spine, your neck and your lumbar muscles. Repeating this 10 times in a day will result in good muscles with good flexibility, because when you do stretches, your flexibility will increase. When your muscle is flexible, then when you will twist or turn, it will not result in pain. Next is bridging. Bridging is a very good activity, as you can see in the diagram. Here the person has to lie straight on the back, and to perform a bridge correctly, the person has to lie down on the back and rest on the outstretched arms by the side. Then person has to lift hips off the floor and keep the body straight. Okay, from head to knees it should be in a straight line. And you have to maintain this position for almost 10 seconds, and this should be repeated 10 times. By doing the bridging, you will be able to strengthen your hip and pelvic area also, the strength of which is very important for pain-free back. Then knee to chest stretches. You can see the person here is doing stretches. For doing knee to chest stretches, the person has to lie on the back with the knee bent and feet flat. Then person has to use both the heads to pull one knee and press it to the chest. Then it has to be holded for 15 to 30 seconds. Then person has to go to the starting position. As you can see in the figure number B, the person has holded the knee and taken up to the chest, and then the person will be holding it. Then the person will be holding other knee and take it to the chest and hold it again for 15 seconds. Then the person will be holding both the knees. So we are having single knee to chest and double knee to chest. Both will result in stretching of the lumbar muscles. And as I have told you, when you do stretches of a muscle, that results in flexibility of the muscle. When your muscles are flexible, you will be able to do all sorts of activity, the twisting, turning activity, bending anteriorly, bending posteriorly. Stretches will increase the flexibility of your muscle. Then lower back rotational stretch. These are for the side muscles of your back. Here, as you can see in the diagram, the person has to lie on the back with the knees bent and the feet flat. Then keeping the shoulders firmly on the floor. So the shoulders should be at equal height. Okay. Then roll your bent knees to one side. Hold for 5 to 10 seconds. Return to the starting position. Then repeat on the opposite side. So we have to rotate firstly on one side. Then we have to rotate over the other side. And we have to hold this position on the both sides. Then seated lower back rotational stretch. This is a stretch which you can perform at your workplace only. If you are sitting for a long time and you don't have place to do exercise, you can do while sitting only. So person is sitting on an armless chair on a stool. Cross your right leg over your left leg, bracing your left elbow against the outside of your right knee. Twist and stretch to the side. Hold it for 10 seconds and repeat on other side. Then shoulder blade squeeze. In this you have to squeeze your scapulas, the bones which are present in the upper back of a person. You have to keep your chin tucked in, your chest high, pull your shoulder blades together. You have to squeeze your shoulder blades, approximate them together and hold for 5 seconds, then relax. This you have to repeat for 3 to 5 times for the pain in lower back. Thank you all, and I hope you have learned something from this presentation. Thank you.